Part of the reason why I became a nurse is because I saw a need. Not everyone has the same socioeconomic background, and people are going to need help.
Lily is a nurse that supports transitions of care for our most vulnerable and sickest patients. But whenever a patient discharges from one of our Sutter hospitals and goes to a chosen skilled nursing facility, our community case manager is there on a weekly basis to ensure the care team at the skilled nursing facility has all the information they need.
At McClure Rehab, we look forward to seeing Lily every week.
Good morning, Miss Karen.
Having Lily as the bridge between the hospital and us is of vital importance. She sits with us and we go through each resident individually that she knows from the Sutter hospitals. And we talk about their care, their cases, and she gives us ideas on what might be a best practice or what might really help this resident get better and return to the community.
I get to help advocate for the patient and do what is right for them. I put myself in their shoes and their family's shoes, and I say, you know, if my mom was in this situation, if my grandmother was in this situation, I want to make sure that they get the best care possible. No one person can do this all on their own. There needs to be more involvement.
Okay, so it looks like they just have her roomed. Do you want me to put a note in?
When we need something from the hospital, she's our go-to, and she can bridge that gap for us and get the information that we need to better care for a resident.
Improving patient care doesn't happen overnight. It takes constant dedication from all care team members. We're constantly encountering new opportunities for us to make the patient experience more well-rounded, and without constant dialogue, this wouldn't be possible.
There are many examples where we have been able to find a gap in the system and repair that gap.
Can I ask that they establish a start of care date before the patient discharges?
Patients are getting better. They're getting better faster. They're returning to the community.
We've seen tremendous results at decreasing our readmission to the hospital and decreasing skilled nursing length of stay. That creates capacity to serve the next patient in need. I think that expanding this is showing that we are invested in moving towards a value-based care environment where patients are at the center.
I love that I get to do this every day. And the outcome is the greatest thing of all, to benefit other people.